My name is Kailey Spicer, and my topic is radiology and how to become a radiologist. So what is radiology? Radiology is the branch of medicine that uses medical images to determine and diagnose a disease. William Röntgen took the first X-ray in 1895, and he won a Nobel Prize for it in 1901. Radiologists are the doctors who actually interpret from the medical images. They are trained to recognize inconsistencies and problems within the body based on just looking at a picture. Radiologic technologists are the people who are actually taking the pictures and controlling the machines. Within radiology, there are three specialties: diagnostic radiology, interventional radiology, and radiation oncology. Diagnostic radiology is where doctors interpret medical images to determine diagnosis. Interventional radiology is where doctors use X-rays to guide small instruments through the body in a non-invasive surgery. Radiation oncology is pretty simple to understand if you know what oncology means. It has to do with cancer treatments. Here I've listed a couple examples of medical images. For example, radiographs. These are X-rays, your typical X-rays to image bones, chest, abdomen. Computed tomography, or a CT scan, is when multiple angles of an X-ray are taken to form an image around a patient. Magnetic resonance imaging, or an MRI machine, is where magnetic fields and radio waves are used in addition to computer processing to create an image. Ultrasounds are where sound waves are used to form a moving image on a monitor. For example, when a pregnant woman goes to get an ultrasound of her baby. Mammograms, fluoroscopy, interventional radiology, these are all examples of medical images that a radiologist might use or look at. CT machines and MRI machines look very similar. I have two pictures of them side by side right here, so it's kind of hard to look at them and be able to tell the difference. So CT machines deal more with bones and the muscles of the body. They are quick, painless, and non-invasive, whereas MRI machines are more noisy and you have to stay completely still, otherwise it messes up the picture. So they can take longer to work through a picture, but they do specialize more in inner organs and soft tissues rather than a CT machine does. Training to become a radiologist really begins in high school. You have to be making good grades, get a good SAT and ACT score. It's also a good idea to maybe join a club, do extracurricular activities. You should be volunteering in your community, whether that be getting hours or serving your community. All of that is what's going to drive you to get into a good college. Once you get into college, you're going to be there for 4 years getting a bachelor's degree. That can be a BA, Bachelor's of Arts, or a BS, Bachelor's of Science. It doesn't exactly matter what major you pick or go into, but you do need to have all the prerequisites it takes to get into medical school. That includes all of your science courses like biology, chemistry, physics. Most med students will major in something like biology or chemistry. However, if you major in that and happen to not get into medical school, there's not a lot you can do with that degree besides maybe join a facility or work with Red Cross. So it's a good idea to major in something like nursing if you still want to get that hands-on work learning experience and maybe try for medical school the next year. Also in college, most students are taking a pre-med course. That's just a program that students take to kind of prepare for the MCAT. The MCAT is an extremely long test. It takes about 7.5 hours to complete. I thought the SAT was bad, and that's only 3 hours. The MCAT is the test you have to take to get into medical school. It has 5 sections, and the top score you can make is a 528. The average score is a 500. So most students are already getting a super high score, so to get into medical school is even more competitive. Let's say you do pass the MCAT and you do get into medical school. It lasts 4 years. The first 2 are spent in a classroom learning like normal, and the next 2 are spent doing clinical rotations. This is the time where you're kind of jumping around to a bunch of different specialties, trying to see what you could see yourself doing in the future, and something you enjoy. Clinical rotations include family practice, surgery, gynecology, internal medicine, etc. Just a lot of different specialties. Clinical rotations do differ depending on what school you go to. So there are different numbers and limits for you to take clinical rotation. Medical school also does the United States Medical Licensing Examination. This is a big test divided into 3 steps. The first step is a test you take after your 2nd year of medical school. The second step happens after your 4th year of medical school. The third step is a test you take after your 1st year of residency. Moving into residency for radiologists lasts about 4 years. Duke University does offer a 5-year combined residency and fellowship program, and I'll talk about fellowship after this. But during residency, you do get paid and you are making money, but you're also training and learning at the same time on the job. You have chief residents who you can report to and ask for help at any time. After residency, you move into fellowship. Fellowship is where you're going into a subspecialty of radiology. It can last anywhere from 1 to 2 years depending on what you're deciding to go into. After fellowship is hopefully a job, and that's hospital-based. Radiologists make anything from $200,000 to $470,000 a year. It's also a good idea to get a malpractice insurance plan, and that's just a liability insurance in case you get sued, which most doctors will have anyway. Here I've listed a couple top medical schools. This includes Johns Hopkins University, Harvard, Stanford, Duke, Chapel Hill, and the tuition price is labeled next to them, and that's just to show how expensive it is to get into medical school in addition to college, and that you have to go through a lot of different hoops to actually achieve your goal of becoming a radiologist, and it's not going to be easy. You have to be very dedicated and determined to get there. A day in the life of a radiologist. Radiologists work an average of 40 hours a week, and that includes obtaining patient histories from interviews or data, preparing reports of their findings. Some radiologists even actually take the images, but most of them will just interpret and diagnose. They also are responsible for communicating the results of their findings to fellow physicians or other patients that may need to know. They can also supervise and teach other medical students. There is a risk in radiology, and that has to do with radiation exposure. Radiation has been known to cause cancer. Back in the early mid-1950s, there wasn't a lot of regulations surrounding X-ray equipment, so radiologists back then were exposed to enough radiation to cause skin cancer and breast cancer and even cervical cancer. Nowadays, we do have rules and regulations that monitor our short-term and long-term exposure levels to keep cancer risk low. We also have protective clothing. For example, when you go to the dentist and they make you wear a big heavy apron before they x-ray your mouth, that's to protect you from the radiation. Speaking of x-rays of your mouth, this is an x-ray of my mouth back in January 2019. The dentists were concerned for my wisdom teeth that were coming in, and there wasn't going to be enough room for them to fit, so I had surgery last Christmas, which was kind of bad because it was the holidays and I couldn't eat anything. This is an x-ray of my arm back in the 2nd grade. I fell on the playground and broke my elbow. If you follow this bone down, there is a crack that kind of goes inwards. I was in a splint and sling for a while before it finally healed. And these are my resources and citations. Thank you.